Okay, we're going to be talking about another one of the oxygen hazards, and that is absorption atelectasis. And absorption atelectasis is when we're administering oxygen at concentrations of 50% or greater into giving it to a patient supplementally. And what ends up happening is that the nitrogen, which is the most abundant gas found in the body and also in the blood, it gets washed out. Now, I want you to think about not so much about the whole body, because it can be used to clear gases in the abdomen and the thorax, but we want to specifically look at the lungs and what giving high levels, 50% or more, FiO2 of oxygen to a patient quickly, what does it do to the lungs? Well, the first thing is, if giving high levels of oxygen, 50% or more, to a patient who's breathing small tidal volumes, it's going to cause the nitrogen to be washed out, which is the most plentiful gas. Remember, we've talked about that, where it could be up to 79% of what is available. Well, that nitrogen keeps the alveoli open. Well, if that washes out, all we have left is the oxygen. When the oxygen leaves the alveoli going into the bloodstream, there's nothing left to keep the alveoli open. Now, if we have an alert patient who can take side breaths and deep breathe from time to time, this is not really a problem. But when we have patients who are sedated, patients who are breathing small tidal volumes, this can be a danger, because now we have no way of reinflating those collapsed alveoli. So if your patient's being sedated, if your patient has small tidal volumes, and you're giving them 50% oxygen or more very quickly, you need to be thinking the nitrogen's going to wash out. That's going to decrease the partial pressure of inside the alveoli. That's what's keeping the alveoli open. And then the oxygen's going to diffuse across the AC membrane, and the alveoli will close and collapse. And that is known as absorption atelectasis. When we have absorption atelectasis, we're going to have the perfusion, but we're not going to have the ventilation. We're not going to get the oxygen across the AC membrane the way we need to. And so the reason we're giving the oxygen is so that we can increase the PaO2 and relieve the hypoxemia. But if we're decreasing our surface area because of these collapsed alveoli, our PaO2 is going to go down. Again, this is absorption atelectasis. I want you to be thinking when it says absorption, what's being absorbed? The nitrogen's being absorbed. The nitrogen's being washed out. Don't get confused and worry about so much what happens in the thorax and what happens in the abdomen. We're specifically looking at what's going on in the lungs. And those alveoli are held open with three gases: nitrogen, carbon dioxide, and air, oxygen. And when those three gases, when they get washed out, nitrogen gets washed out, oxygen goes to the hemoglobin, CO2 gets exhaled, that alveoli collapses, we end up having that decreased surface area, which hurts our oxygenation of the blood. And that's where we end up having a VQ mismatch, a ventilation perfusion mismatch. So again, that's absorption atelectasis. Think of the nitrogen being absorbed and then the oxygen being absorbed. And the key here is that levels, administration levels of 50% more of oxygen very quickly will cause this to happen to your patients if they're breathing small tidal volumes, and that normally will occur if your patient's sedated.